This is going to be a technical support video that supports people that are just having trouble with downloading the Google Sheets version of our free Breast Cancer Pathways Research Project Worksheet 2021 update. So you should have by now listened to Maria's intro. She decided that I should give the technical video. So this is the second video after the intro. And we'll start here. How do I download the worksheet? So it is recommended that you use a computer. There is Google Sheets, a free app for your phone, your smartphone, your tablet. It being a large worksheet, it will be hard to really look at and get a real feel for the worksheet on a really small device. So get yourself in front of a computer and make sure that you have a Google account. This usually gives you straight away a Gmail email address. So if you've got a Gmail email in your swag of emails, then that means you've got a Google account. For me, when I'm logged into my Google, up here in the top right hand corner, you see that little red A that represents that I'm logged into my Google account now, because I have been opening my Google Sheets and my Google Docs throughout the morning, and that's why I'm logged in, and that's now active in the background, spying on everything I do. Anyhow, you do need this free Google app called Google Sheets. So make sure you take the time now to go and make sure you are logged in to your Google account. Create one if you haven't got one already. It doesn't take long, it doesn't cost anything, and the payoff, which is this free worksheet, is worth it. Okay, so what you'll then do is click on this image here where it says click here, and that will open up a new window in your browser that you're using on your computer. And if you haven't already signed in, you'll be invited to sign in to your Google account. Better idea to sign in first, as I just suggested. And you'll see a screen that looks like this: copy document. So it's going to open the document and it says, what do you want to do? Yeah, you'll click on make a copy. And then, and I'll go through this with you in a second, you'll then be asked to, well, you won't be asked, but you'll see that the copy is called, the title of it's called copy of. You want to edit that. You want to highlight the words copy of and actually pop your name in. So Anna Smith, you can even write the period of time that it's reflecting. When I say reflecting, just put in maybe the month that we're in now, or if we're sort of towards the end of a month, do it this month and next month, because it might take you a couple of weeks to or longer to get to grips with this worksheet and enter your data and discuss it with somebody. At the very bottom of the screen, I'll show you in a second, there's tabs. So there's many pages to the worksheet. Today in the technical video, we're just going to look at the first one on the left, enter master data. And once you have your own personal copy, your first task, technical sort of task really, is just using the enter master data page to indicate whether you're taking, considering taking, being suggested to take, cycling, taking 1 week out of 4. Indicate next to each supplement or drug your response, or just leave it with the little dash as blank. This is the first task to do, and then all the other pages in the worksheet will reflect the answers you gave on this enter master data page. So let's start with getting our own copy of the worksheet. Click here. Excellent. Would you like to make a copy? Yes, make a copy. There we go. Now I want to make sure it says here, Abbey Mitchell, and it is now, we'll call it Jan-Feb 2022. Can you believe it? And then if I click somewhere else on the sheet, I don't have to save that. It just automatically saves. Amazing thing about this Google Sheets, it's constantly saving back to your Google account. I heard from a member of the group that was having troubles with this process that she needed to get herself a Google Drive. So things might have changed with Google a little bit in that you might need to sign up for a drive in order to hold this worksheet and download it rather than just view other people's worksheets. You can't really view other people's worksheets, they're personal. So we've made this, the only way we could sort of make this and share it without getting involved in the sharing of each one was to make it so you automatically create your own copy. So you will automatically need a Google Drive. So if you don't already have a drive set up with your Google account, click on your little Google icon in the top right hand corner there, Google account, and just make sure you go in and set up a drive for yourself. The first page just shows you where you came from, really, the Breast Cancer Pathways worksheet. You might want to bookmark that original intro page so you can share it with others. It's actually on the myhealingcommunity.com website, which is another super valuable website. Another page on there is the A to Z list of threads and files. And many of these drugs and supplements have a conversation thread dedicated to them within the Facebook group that myhealingcommunity.com looks after, which is the Healing Cancer Study Support Group. So anyway, go back to myhealingcommunity.com and look around. So bookmark that. Breast Cancer Worksheets is a page within that worksheet. So that's page one, but look down the bottom, they say it's the welcome page. These are the tabs, these are all the pages in the worksheet, and they go on. Look at them across there. The other way to look at them is this little horizontal lines down here. That's like a little menu that pops up and shows you all the pages within the worksheet. So we go back to welcome that way. If we want to go to the next page, we could just go there and go enter master data, or we could navigate along the bottom of the screen to the other pages. Just so you don't get overwhelmed, the best way to handle this worksheet is page by page. So we're going to start today with the technical aspects of entering the master data. This has been set up with the help of Apan's charity in India, the Art of Healing, and we didn't know technically how to make this happen, but thank you, Apan and the Art of Healing, for helping us automate this worksheet so that you don't have to continuously indicate your choices under every pathway again and again and again, which is how the old worksheet worked. In this case, if you're not taking, or you're not interested, or never heard of something, never been suggested it, then just skip it, leave it blank with this little dash, but go down one by one and use the drop down menu to indicate whether you're taking it. See, no, it's a little bit slow to change color, but yes, I'm taking andrographolide. I'm taking it in the form of andrographis. And right here, I could enter my dosing. So at the moment, I'm actually in remission. I'm taking 500 milligrams once daily. And if you don't know what something is, like this one here, I suggest you, but maybe it rings a bell. I think, oh, you could Google that. You could look it up in the A to Z list of threads and files in the Healing Cancer Studies support group. You could put yourself a little asterisk, or maybe even change the color here. Don't change anything to the left though. Like, don't get in here and write notes on this in this column here. Consider it locked, that column. Don't touch it. And don't touch, other than just choosing one of these options, don't just touch anything in column B. So column A and column B, don't actually edit them other than just using the drop down menu to make a choice. But if you've got some reason you want to highlight something, you don't understand what it is, you want to come back, maybe you can create another little note to self, by putting red there, meaning I want to come back and I want to look at this and understand it more before I'm finished with the Enter Master Data page. So it's a long list, and there might be more that you're taking beyond this list. So at the end of this list, there's space to actually just put in some notes about any extras you're taking. These substances and the drugs, herbs, even some of them are therapies or activities. They're not everything you can do for cancer, but these are the ones we've come across in the research for this project. And so we've just organized them A to Z. And you see, we're only up to G. There's tons of them. So take your time, look them up if you're not sure what they are. If perhaps somebody suggested something, you can put it there as suggested. If you're cycling something, sometimes the order of these choices moves around. We can't control that. That's just something we get because Google Sheets is free and so accessible and we put up with. There's a lot. There's a lot of things in there that I am taking. I'm not going to sit here and go through them all. Down here, we've got the same choices, but blanks. So you can add, if it hasn't shown up on the list above, add it here. It will not show up in the other pages just because you add it here. But if you're sharing this worksheet with your practitioner to give them a really easy to access, because you can just share the URL at the top with them. Like you can go up here and you go share this worksheet. You can put your doctor's email here, or you can down here get a link to the worksheet and share that with your GP or your naturopathic oncologist, your integrative oncologist, or your oncologist if they're somebody that's got more than 15 minutes and interested in what you're doing outside of the standard of care drugs. It's good for you to really look at everything that you're taking on one sheet, and you can include the dosages and any other notes. Maybe over here you might want to, in this far column, you might want to put the URL to where you buy it online, so that it's easy for you to reorder your supplements and drugs, or So yeah, once you've got, we're not going to go into these other pages now, but just so you know, like once you've actually entered your indicated, it's come up here, it comes through to the other pages. And so when you're learning about the research for that signaling pathway, down here, your answers on entered data, master data, will be reflected and give you an indication about how strongly you might already be modulating that pathway through your existing choices. So this is just the name of the substance of the drug from that A to Z list carried forward when we found that it was seen to have some effect on that pathway. And more than likely, it was just in a cell line study. It wasn't actually in a clinical trial. Very, very few clinical trials are done on these herbs and nutraceuticals and over-the-counter, off-label medicines, because there's just not an incentive. There's no funding to do it. The funding comes from the incentive of the pharmaceutical companies bringing a drug to market. There is a market. There is an industry, without trying to sound like a conspiracy theorist. There is actually a health system, and what keeps that health system here and working is much more than the taxpayers' dollars. It's an industry called the pharmaceutical industry, which basically has to put funds up for a lot of money goes into trialing and then maintaining a product in market, as long as they've got the patent for that drug, there's money in it for them. But then when something becomes off-label, it no longer is something that they have that monopoly over, and or if it's a nutraceutical, it's often something that somebody can grow in their own garden, get from a herbalist. Like, it's not something that can make them money to make it viable to bring it to market. So yeah, you won't see this kind of stuff going into clinical trials very often at all, unless it's supporting an existing drug that needs support, which they all do, because there is no magic golden bullet for cancer. Even with a breast cancer that has many drug choices, because the first one fails and the second one fails and the third one fails. This information here that we'll get into in the next video is broken down page by page. Each page or tab, they call it in the worksheet, represents the different hallmarks of cancer and the research that we've found that relates to that hallmark, and they're called pathways, just to keep it simple. And then it's also broken down into subtypes. So here we go, the hormone-driven subtype, which I am, for instance, the triple positive, which includes the HER2 positive, and then the triple negative breast cancer. And yeah, so you just have to look at what it's obviously estrogen signaling. It's important for all hormone-driven cancers. And then these are some of the substances that we have found research to indicate modulates that estrogen signaling pathway. These are the substances we've found that there's research that indicates they modulate the hedgehog signaling pathway. And then from there, you can go and look and say you were triple negative. Oh, wow, this is one of the most important pathways. And this is a link. So here you'll see the hyperlinks come up. You can click, there's two links there that you can learn more. So this is a learning tool. It's not an answer to everything. It's a learning tool. You can then get some more information there. I mean, and what would be the purpose of this? I guess for me, as somebody that doesn't have the capacity to work with an integrative oncologist or naturopathic oncologist, and I'm working with a GP who's open-minded and wanting to support me, is that I can then print out these studies or send them to my GP and say, look, I think with my triple negative breast cancer that the hedgehog pathway is something that is worth modulating and inhibiting, and I want to add mebendazole. I'm in Australia. This is an over-the-counter medication. How do you feel about it? Can you monitor my response to it? I was thinking, as well as the mebendazole, I might cycle that from the sake of my kidneys, and I'd like to do some sulforaphane. Can we discuss that? And so yeah, it's a tool to support your learning. It's not an answer to everything. It's, as we said in the intro, it's an expansion on what was kind of triggered in us by reading How to Starve Cancer by Jane McClelland. And her instructions are to explore and learn more about your phenotype. And so every cancer is quite complex, and at different stages it's going to be upregulating different pathways. And this is why it's sometimes important to take the time to read through this worksheet, make the indications, and sort of sit back and maybe talk to a practitioner that specializes in cancer about your stage of your diagnosis and what drugs you're on, and what how are they being metabolized through your liver. And by introducing other herbs or off-label drugs, how is this going to impact the therapy you're already on? And trust me, you need to also double check all the information your oncologist tells you. And by double check, I mean go and look and see if there's research to indicate otherwise, especially when they say don't take anything else other than these drugs that you're on. That to me is really worth double checking, and understanding why is important. Understanding the whys about what they say. Yeah, there's this courage that we need to develop as patients of oncologists, and that's to question their black and white thinking, and also learn ourselves about the pathways that their choices that they're making on our behalf. What pathways are they inhibiting, and doing the research around the resistance that can occur to those choices that they're putting forward, and get an understanding about how the resistance comes about before it comes about. That's really kind of what I think is the gold in looking at the information here in this worksheet, is having this easy access to get you going, to do the research about what pathways, other than the ones that are being inhibited by your oncologist, what are the other pathways that are likely to get upregulated when that pathway is targeted by your standard of care drugs. And this is where the science is, but the oncologists don't sit there and educate you and get ahead of the game. They wait until you have the reoccurrence. They wait till you become resistant, and then they put you on another drug that you get resistant to. I mean, I'm sounding like a nut bar, but 5 years ago, I was diagnosed with secondary breast cancer. And in those 5 years, I have lost so many beautiful friends in this lifetime. I'm hoping to meet them again somewhere in our soul's journey. But beautiful women, wise women, doing everything their oncologist said, and waiting until they had resistance before they started understanding what their drugs they were on were doing in relationship to the other pathways that cancer uses through the lens of this hallmarks of cancer. Yeah, it's exciting, it's empowering, and we'll go through together, Maria and I, each of the pages one by one and do a video, each of the hallmarks, just to break it down and help you kind of get into it a bit more, get your teeth into it. That's it.